we think about COVID and the impact on healthcare, in some ways it exposed a number of the problems that we already have and that we've lived with for some time. That we know we have a system that isn't as well coordinated as it should be.
There was no supply chain in any industry that could be prepared to respond to that level of increase in demand. And it's important to notice that really is the core of why we saw a lot of shortages. They were exacerbated, though, by as countries looked to protect their own populace and look to prevent the further spread of the pandemic, you did have a lot of countries outside the US shut their borders to exports of PPE products and choose to hold those products in for their usage. You also had labor disruptions as folks were forced to go on lockdown and stay home, which affected manufacturing in a lot of industries.
Policymakers are going to need to turn their attention to what are the essential medicines that we need to bring back onshore. What are the alliances that we're going to need to make with our allies to make sure that essential medicine production and distribution is centralized? And how do we make sure that we can get those services and medicines distributed equally across our population, regardless of location and socioeconomic background?
We've already seen the government subsidies to help hospitals, stay afloat. We've seen the rapid pivot and impressive pivot to telemedicine and remote patient monitoring acceptance from patients and providers and systems that support them. It'll also be important to build consumer trust in health sciences, build consumer trust in public health organizations so that we as a nation have a stronger foundation of understanding to build upon for a future health crisis.
Right. It's reasonable to think we probably won't have to wait 100 years to see something else, unfortunately. So let's make sure we're taking the right lessons here and working together on that.